Hello everyone and welcome to today's YouTube video. Today I'm going to demonstrate supine and semi-supine positions. First of all, starting with the supine position. Supine position is the position in which you lay horizontally with your face and torso facing upwards. So the supine position is one of the most natural position for a patient, and it usually allows the patient's anatomical structures to remain in natural neutral alignment. Most of the patients in the supine position are able to maintain adequate respiratory function without any external force compressing the respiratory system. Now, let's see how to move a patient into a supine position. Let's start with the bed flat and patient lying on the back. The patient's head should be about 2 to 3 inches from the head of the bed. Place a trochanter roll along the affected hip or along both hips if the patient has little control over the legs. Fold a bath blanket lengthwise in thirds. Position the patient in the center of the folded bath blanket. The blanket should extend from mid to lower thigh to the waist. Roll each side of the blanket under and towards the patient until the blanket roll is firmly against the patient. Then tuck the roll inwards towards the bed and the patient to maintain the patient's position. Now, place pillows under the legs to reach from above the back of the knee to the ankles so that the ankles and the heels do not rub on the sheets. Lying flat on the back is very uncomfortable for some people. This is especially true for people with lower back pain. Elevating the knees with a foam or pillows will relieve pressure on the back and reduce discomfort. Now, extend the patient's arm and place small pillows to reach from the elbow below the wrist. Now, let's see how to move a patient into a semi-supine position. Semi-supine position is also called the tilt position. When the semi-supine position is used correctly, it can relieve pressure from your hips, sacrum, coccyx, and buttocks. The spine of the patient is straight and the patient is positioned so that he's leaning against a pillow. Now let's see how to move a patient from a supine position to a semi-supine position. Turn the patient on the side facing away from you. Position a pillow behind patient's back. Push the patient slightly back against the pillow, then roll and tuck it under to support the back and relieve pressure on the arm or shoulder. Pull the bottom shoulder slightly forward to prevent pressure on the joint. Position another pillow under the patient's top leg. Position the top leg slightly behind the bottom leg, supported by a pillow. Position the patient's upper arm in a position of comfort. The wrist may rest on the pillow or the abdomen according to the patient's preference.